Recording in progress.
Hello, hello. Okay, Jean, are you ready? I'm gonna have Donna come up to the intro section, okay? And then we
Yes.
start from there.
Okay.
Welcome to today's webinar with eLotus, the leading provider of acupuncture continuing education. My name is Donna Chow, and I will be your host and your moderator for today's class. But first, exciting news. We have a brand new addition to the core section of our website. Check out LCH Auricular section dedicated to the renowned auricular medicine doctor, Dr. Lee Chung Huang, hence LCH Auricular section. Discover how Dr. Huang effectively treats various ailments using only the ears. Just click on Core at the top of the webpage and explore this new section. We'd love to hear your thoughts. Today's class is TCM Strategies for Elderly Health, CHF, Sinus Issues and Dementia, and sponsored by Evergreen Herbs, and will be presented by Roberta Jean Leong, who has been teaching with eLotus since 2016. To browse her video courses on treating lupus, Lyme, or severe infections, visit us online at elotus.org. All right, so before we dive into today's class, let's ensure an engaging and informative session. Please set your chat preference to everyone in the chat room so that all attendees can see your messages and participate in the conversation. If you have any questions for Jean, please type them into the Q&A box. And remember, after the webinar, there will be a quiz available the following workday, and we'll notify you by email once it's ready. Today's class will run from 8 a.m. to 5 p.m. Pacific time, and we'll have 4 breaks throughout the day, and lunch scheduled from 1 to 2 p.m. 12 to 1 p.m. Sorry about that. So lunch again, 12 to 1 p.m. All right, so our speaker today is Roberta Jean Leong, a highly experienced clinician, author, and instructor. She's been a licensed acupuncturist in California since 1985 and has had the privilege of observing the legendary clinician Miriam Lee's practice during her early years. Jean's extensive knowledge and background makes her an excellent resource for this topic. All right, so without further ado, let's welcome Jean Leong. Jean, please feel free to share your presentation now.
Sure. I became interested in using Chinese medicine to help heart disease because people in my family were not doing well. And I didn't get any requests to help them, but I saw people in their 40s, 50s having very severe problems. And I thought, well, I have some of those genes, so I don't think I want to wind up with these problems. What can I do to help them if they ask me? And what can I do to make sure that I don't have these problems early in life? Somebody in my family was out for a bike ride. He was in his 40s. He had a heart attack, dropped dead on the trail, and by the time help got to him, there was no hope. So what I was thinking after that is I need to learn everything I can that is basic from Western medicine and see what there is in the texts that I have for herb medicine and try to remember the way that my mentor would have treated people. And at the time, this was all very new to me. I didn't start doing acupuncture thinking that, oh, well, I want to try to treat heart disease. That's not what happened. It was more a matter of, oh my God, these people are dropping dead. Is this going to happen to me? Can I do anything to make sure that if somebody does ask me, I know how to help them? And so I started reading about this stuff from all kinds of different points of view. And I did read about a lot of the heart treatments in herb books. And some of these texts have names of formulas that don't 100% match what's easy to buy, meaning that, you know, there are some formulas with a specific name and you go and you buy the pill or something like that from one of the suppliers. It's not always exactly 100% the same thing in these old books. And then I also found an old handwritten notebook in my family from someone who had learned to do herb medicine. And I can't read the whole thing, but again, the same thing happened. So I just thought, well, I really better understand the properties of each of these herbs and what the whole concept is. And I have treated a few people now with Chinese medicine, and they are generally helped with acupuncture and Chinese herbal medicine. And they have to have a better diet. They have to have better exercise. So I really think some of these very serious diseases can be totally helped with Chinese medicine. I don't think people have to have Western medicine only or Western medicine at all in some cases. And I think people can recover. All right. So cardiovascular disease is what usually starts everything, and then people can have congestive heart failure. So CVD is the short word or term or acronym for cardiovascular disease. CHF is congestive heart failure. And in the United States, many people in their 60s and over have a lot of heart trouble in one form or another. I mean, there's an enormous amount of people who are constantly taking medication for hypertension, and their doctors are probably doing the right thing by helping them lower their blood pressure that way, but they don't usually try to look for the root cause and help them with that. And so at this point, I'm happy to say that my family history hasn't caught up to me in that way. And I think that all the information that's out there means that we can all find something to help us, help ourselves, and help our patients. I went to the library, I read things online, and I'm always looking every month or two at what new research there is, because both Western medicine and Chinese style testing, like herb formulas are being tested to see if they really do or don't help. Individual herbs are being tested to see if they really do or don't have a particular effect. And in the United States, research has been going on since data was collected. And then after this data was collected, there's a lot of information that they were able to examine. And one of them is the Framingham Heart Studies. And there's a website. So I've posted it here because if you want more information, there is quite a bit of information available. And then in the US, there's 2 websites, and they get updated every now and then. And the information is not static, because just like the Framingham studies, as there's more information, they are able to provide additional details. The 1948 year marked the start of data collection. And before that, everything was sort of just word of mouth, but they started looking at the cause of heart problems. And there were thousands of people included. And to start this research, they just collected data. They didn't do anything else. They just collected data. And this study went on for a long time. And then all of the descendants of the original participants became part of the study. And now it's on to a third generation. There's information posted now on their webpage. And I've looked at it all. Sometimes I look at some of these Western data sets and I think, oh, that doesn't really sound right, or I don't agree with it. But there's so much data there, and I think all their analysis makes sense. And one of the things that happened is they started including different types of people. And a lot of correlations were found. Interestingly enough, most of the data that was first collected focused a lot on men, not women. Now that's all changed. When they sorted out the data, there were a lot of things that they found, and two things in particular became red flags. So they found correlations. That is, people who had died of heart disease or had a serious heart health event almost always had a couple of problems. And when I talk about correlation, that's not the same thing as the cause of something. I have a typo here. It says in the study, red flags are identified. Anyway, there are useful to know these things. And even though it's kind of out of our scope of practice as Chinese medicine practitioners and clinicians, at one point I had people who would always bring in their labs to me and show them to me. And I would never order labs. I generally just looked at stuff that people hand to me. For this study, not all the causes are understood still. Two really big things showed up, and so doctors, primary care providers, general practitioners always pay attention to these things. One of them is if someone is having high blood pressure. Now, as people age, their circulation changes. So when they are younger, they tend not to have so much plaque or problems in circulation, but almost all of us, as we get older, there's going to be a higher blood pressure for the body to function normally. So for seniors, meaning middle age and older, or maybe certainly by 60 or 65, if somebody has blood pressure of maybe 135 over 85, that might be just fine. And if somebody's 30 years old with that blood pressure, it's probably not okay. And the reason is, as the arteries and circulation gets a little more constricted or obstructed, or the arteries start to harden, then a little more blood pressure is normal for blood to get everywhere in the body, especially to the brain. And I've seen people who are in their 70s who have high blood pressure, or 80s and they have high blood pressure. But when their doctor gives them medication, they're trying to bring the blood pressure down to 110 or 105. And these people will stand up from a chair and they'll faint. And we don't want that. So you have to pay attention to the age and decide if you're going to take blood pressure in your office as a clinician or you're not. And if you do take the blood pressure and they have high blood pressure, if they don't have Western medication, then it's a good idea to treat them, but also ask if they have a primary care provider, and they should have a discussion with their Western doctor if they're on medication. The other big red flag is high cholesterol. And the same thing happened to me about the lab test coming in. Is I did not make it a practice to order blood tests. What I wanted to do is use Chinese medicine, but people were starting to bring in these lab tests to me. I mean, quite a lot. And some of these people had really high cholesterol and would say things to me like, well, I think I want this kind of medicine, not that kind of medicine. Can you help me get off of my medication for high cholesterol? I said, well, I can, but I don't want you to go off it immediately. It might fluctuate wildly. And I think that's really the scope of practice for your doctor. And you have to be careful because if you do both the Chinese medicine and you have acupuncture and herbs, and things start to move around a lot, you don't want to have your blood pressure dropping too much too fast, and you don't want your cholesterol to crash. And the typical response I would get is, well, I thought that very low cholesterol is better, but cholesterol is a precursor molecule. And so people get cholesterol from food, and their body makes some cholesterol and it goes into the skin. And when people go into the sun, then it gets converted to other things that the body needs. One example is vitamin D. So because we have so much vitamin D deficiency in our country, I think it's mainly because people aren't having a great balance of outdoor activity where they get a little sunshine. There's some information online about this, and there are people who want to have, oh, my cholesterol's at 260, I want to get it down to 80. I don't know that that's a great thing to do. Maybe their doctor says that, but I don't really think that's the best idea. I think there are healthy people with cholesterol that isn't high, and that they're going to be healthier if they have some cholesterol in their system. Okay. After the study, this big study, got all these correlations sorted out, these two conditions were pretty severe, and they decided, well, we're going to have a better result if people drop their cholesterol and they drop their blood pressure. And so now we have a lot of medication to help people bring down the cholesterol and bring down their blood pressure. This worked well enough so that these kinds of treatments started around 1960 something. And in the 70s, more things were developed and a lot of patients started getting them. Now I think it's very common that if there's high blood pressure, if there's high cholesterol, that the normal thing is the doctors automatically try to get their patients on this stuff because it does lower the heart attacks, as we say, catastrophic heart failure events. It keeps people from dying early. And I think for a few decades, these medications just seemed like wonder drugs, and they were helping the population to have fewer heart attacks at early ages. But the data shows now that in 2017, it was still helping people, but the rate of change didn't continue, meaning that the percentage of people that were being helped was flattening out. So you have this decline, but then it was plateauing. And there was no significant improvement, even though people were on the medications. The other thing that the study found is that lifestyle has something to do with these heart health problems. Smoking is really horrible, and people have congestive heart failure and cardiovascular disease at a much higher rate. And if people don't stop smoking, these heart problems remain serious health issues, and they tend to get worse. Hypertension and high lipid panels and smoking are definitely known to be risk factors. Everybody thinks that smoking is a direct cause, but we're not sure why hypertension and high lipid panels are such a highly correlated factor. But we know for sure that smoking hurts the system in many ways. When we talk about heart health, lifestyle has something to do with it. And there are a lot of people who don't exercise. I know people who have told me, oh, well, I was busy working and my doctor never talked to me about exercise until I was about 60. And to me, this is a great shock. And then there are other people who are very overweight, and a lot of them have told me that they don't exercise and they eat too much because it's a way of coping. So they're inherently depressed or having some kind of problems with their life. I think there are people who drink to try to relieve their stress. So I think alcoholism or excessive drinking hurts the whole system. And I think a lot of people don't know how to have a healthy diet. Even people who want to may not know how. So I wanted to find what the Chinese medicine ideas for long life were. And I found a couple of whole books that talked about how acupuncture and herb medicine help, and also lifestyle choices are going to improve people's opportunity to have a long life. And exercise and diet is always included, but it's not exactly the same as what's in the Western medicine approach of trying to improve somebody's diet. So for cardiovascular disease, there are a couple of herbs that appear when you look at the formulas when you are treating people who have qi and yang deficiency that are very severe, and the system is depleted of energy and lacks heat. So you'll find these in a lot of the formulas, but if you have a patient that you're sure has a serious cardiovascular disease problem, you don't want to use any of the formulas that have this aconite herb for too long. And it should only be used when you take the pulse and it's very weak, meaning that when I take the pulse of a patient who needs this kind of treatment, it's sometimes close to imperceptible. And if you listen to the heart, you can tell the heart is beating, but it's lacking in normal energy. So we'll go over some of the formulas that help the kind of patient I'm talking about. The people who really have these cold and yang deficiency problems will have cold spots in their bodies, or their hands and arms will be cold, or something in their body will be cold. And also the other symptoms will show up where, if you look at the tongue and the pulse, you're going to find that there's a pale tongue and the pulse is not rapid. And when the cold is permeating the system, it will eventually deplete the spleen, and it gets so deficient that people will get diarrhea. So this is Suni Tang. It is a formula that you want to give to somebody who has this type of cold problem, yang deficiency problem, where it's affected the heart channel and the middle jiao. If there's heat of any kind, whether it's true heat or it is yin deficiency heat, this is not to be given. It'll just exacerbate the heat problems and then make it more complicated to treat the patient. So Tong Mai Suni San, Suni Tang. The translation of the words, they describe this as unblocking the pulses and invigorating the circulation. And they're talking about blood circulation here. This is where there's some lack of circulation that is so severe that you're going to find the tongue is not pink. It's usually got a spot, or the whole thing looks sort of purplish. And when you touch the pulse, it's hard to feel. I mean, this is again due to the heart being weak and the system not having enough energy. And the hands or the feet or both will be cold. The arms and the legs will be colder than the torso. This next formula uses ginseng. And these people with this problem are thoroughly deficient. They they move around just a little bit and they're panting because they're short of breath. They can't stand to have a change of temperature, to be a little bit cold. If they're living by themselves or in a room where they have control the temperature, they have the heat on. And in the summertime, they go outside, they still have to put on a sweater. So this is a type of deficiency. And it's very common to see congestive heart failure. So congestive heart failure means that the circulation is so bad that the whole system kind of is not able to be normal, because the heart hasn't failed, but it's weak, and maybe there are arrhythmias or heart palpitations. And this is where someone's got really a problem that can result in edema. This formula doesn't address edema necessarily, but it's from the etiology, where you have to help the young, and the chi cannot be restored until the young is not collapsing. It's sinking and it has a deficient quality. Zhen Wu Tong. So this is True Royer soup. It's a very hot formula, and by this time the kidney and spleen are depleted. So if the kidney, yang, and qi are depleted, there's going to be insufficient urination. You might see edema. And if the yang and qi is depleted from the spleen, there's going to be diarrhea. And if all three of these are depleted, you're going to see some cognitive impact. They're going to have impaired memory, or something is not right. So if someone uses their mind for their job, they're not going to be able to do their job. Like, if somebody isn't doing that kind of work, it won't affect them as much, but they're going to be fatigued and tired. Yet when they lay down at night to go to sleep, they're either not going to sleep well, or they keep waking up. And if you have all three channels being affected, it's not as severe as when the pulse is imperceptible, but these people are still very unwell. This is the ingredients list. So it's a formula that can be modified, and if you're sure that your diagnosis is correct, and you know this person is having partial or has just had heart failure, this is a list of the herbs to add to this formula. And if it's some palpitations or arrhythmia, then you add the guaizhi, the cinnamon. If it's the arrhythmia plus edema, then you use the Zhen Wu Tong formula and add two things. So that's what this list is. So I'm going to go back one page here, one slide. 2 slides. Okay, so this is the base formula. And then if you have heart failure, you add this, but not everybody who has this problem has heart failure. So then this is the other modification. So this slide shows 2 modifications. This is another yang and qi deficiency type formula, and it doesn't have the aconite in it. It's for a person that has bad pulses, poor, weak pulses, meaning that if you touch the pulses in the wrist, but also, like at couple different areas, the pulse just feels weak. And you're going to see this with patients probably who have already been diagnosed as having heart trouble. And they're not going to be able to walk well because they get tired. And if you see somebody who gets short of breath very quickly and complains of their heart rate, their heartbeat being not regular, this is a formula to consider. So it's a hot formula, but it's not as hot, and it's not as much of an emergency if a patient needs this kind of formula. It's a much more chi level problem that helps to get the heart more normal and move the blood. The prior formulas are all more kind of like emergency formulas when people are having this yang collapse, so that when you feel the pulse, it feels like the whole system's going to fail soon. I'm not saying these people can't die from heart failure. They typically have congestive heart failure already, but it's not as severe as when the yang and the qi both have totally collapsed. So mai mendong, that herb helps when the system is too dry and the yin deficiency is affecting the person's sleep. So the formula has, if you look in any of the books, you're going to find different amounts of the ginseng listed and a range of how much to put in. But you can take like the normal range at the high end of the ginseng and then double it, just that one herb, if the pulse feels like it's about to become too weak, if it's weak but becoming imperceptible. You don't want to increase that herb, and you want to use just a moderate amount of it for somebody where the pulse is weak but not so faint that you're concerned it's going to become barely perceptible. So I felt the pulse of people with very serious problems, and when they first start having heart disease, usually there's an irregular heartbeat. As they start to have more serious problems, then the pulse becomes faint, and then after that it becomes hard to find. Like the wrist points where you take the pulse, all of the pulses, both surface and deep, start to become hard to feel. And when you find a patient that has a pulse that's almost imperceptible, I really think that they can still be helped if they can take herbs and they can tolerate acupuncture, but they're really in trouble. A lot of those people, I don't think they're going to make it. They're not going to be able to be resilient. And so everything else will become important at that point, like how much they want to live. Everything else kind of hangs in the balance at that point. Anyway, so you want to increase the amount of the ginseng when the pulse is faint, but it's not yet become imperceptible. And if you have a faint pulse, but it doesn't feel like it's headed towards becoming imperceptible, you'll probably feel a pulse that's weak, but it's irregular. And that's when they complain of having persistent palpitations. So the typical formula is cinnamon and guaizu and longu and muli. So cinnamon, fossilbone, and the oyster shell. Some of these people will improve, but then they complain of having insomnia. That is, they're tired, they go to bed at night and they try to sleep, but they wake up over and over again, or they can't fall asleep. Any type of insomnia with a faint pulse and a regular pulse, and they're complaining of this problem where they have insomnia, poor sleep, palpitations, then all of these herbs in this list are good to add to the formula. It's very difficult once they reach this point, because if they can't sleep well, they're not going to improve. I mean, they're weak, they're tired, and what they want to do is sleep, but their system is so out of balance, they cannot stay asleep and get to the level of sleep where the healing can be thorough. So remember, when you do your diagnosis, all those above formulas are appropriate, but you have to make sure these patients don't have heat symptoms. If you find heat symptoms and you give them any one of those formulas, there's going to be new problems. I haven't seen a lot of total yang depletion. It happens at the end of life a lot, but I think having these very qi deficient and yang deficient systems, these patients get that way from sometimes overworking. But other countries, you're going to see it a lot more where you're not in a first world country and people don't have good living conditions. They're starving a lot or malnourished. They might be living in some kind of environment that's got inadequate shelter, especially in the winter. They might not have enough clothing. In the United States, I think, being a first world country, you're not going to see yang and qi collapse from those same problems. I think it's more when people are either at the end of life naturally through old age, or they've had some set of prolonged efforts that's caused them to deplete their system. And this will not have happened all at once. It's very rare that somebody will have this problem for no reason all at once. It's usually because something has depleted their system, and it's usually through some kind of effort that's long and sustained. So it can be from something that could be work-related or family-related, where they're having to have prolonged exertions. So people complain of palpitations and arrhythmias, and they don't feel well because since the heart isn't having normal pumping action, the system doesn't get enough oxygen and blood, doesn't get enough qi. And a lot of these people are told in Western medicine they have to have surgery and have a pacemaker. If they don't get a pacemaker, they're going to have a poor quality of life. But I don't think pacemaker is the only answer. I think Chinese medicine can be tremendously helpful. When this problem has been going on for a while, they're going to have blood stasis. And I've seen this, but I don't think most people that you see typically have this problem. It's the first step, I think, to show that there's a heart problem that hasn't been totally addressed. I think it's usually that the pumping action of the heart is weak, so the body is going to route the blood to areas that it is finding more critical to get the blood and the qi. When you do see somebody like this, the tongue is going to either have purple spots or it's going to be all purple. And as it tends to affect the whole body, eventually, if there's some purple spots, it will just start to get worse if the person doesn't get well. You can feel the pulse. It will be irregular. And if you look at the tongue, if your treatment is working, the purple spots should go away or the tongue might become more normal in color. So then the big question is something like this, if you do acupuncture, can it help people with this type of blood stasis? I think it can. I mean, I've certainly been able to help people, but I think that if you see something this severe, they need more than just acupuncture. Maybe they need herbs. Maybe they need to get to the root of the problem. And I don't know if you've seen this type of problem before, but when you have blood stasis that comes on from new stress, people just look wrong. Like you might find a couple spots on their body, but it'll look like a bruise. And if you ask them, they didn't have like an impact or an injury or any kind of trauma. And it just doesn't look right. And it's very pronounced. It's really purple. I mean, it's purple like a bruise, a dark color. And sometimes it's bluish. I mean, it's very not normal looking. Let's see if I can show this color. I mean, this has a lot of blue in it, but I'm talking about this kind of purple. These purple spots on the body. When I first saw these, I just thought, well, that just doesn't look right. Anyway, it's from blood stasis. I think that the best acupuncture for this is to use these points on the list here. This is what I've done. And I've had good results with it. People typically need the stomach 36 point because they usually don't get into that position and condition unless they're deficient. So when I needle, I usually will pick 3 or 4 points and needle them bilaterally. So it's a total of either 6 or 8 points. That's typically what I like to do. This soup, it's a decoction that can be made when you see this blood stasis problem. The honghua, the carthamus, I think is a very powerful herb in this formula. And then in this list, it says danguai, but it should probably be best as danguai wei, meaning the end part, the tail part, because it's more powerful for breaking blood stasis than the tonic, which is just the danguai. Let's see, and oh, I have a typo here. Sorry about that. Ligusticum, chuan shong. That one's very powerful for breaking up stasis. And you're tonifying with a couple of these herbs, but also it's mainly to break up blood stasis. So this kind of mixture can also be given to people who have been injured. But the reason I have it here is because it helps people with this kind of congestive heart failure problem and cardiovascular disease that has progressed to the point where people are getting blood stasis in their bodies. they have in this formula, they also include the the RNTI, and that one is to help move the chi. But when you have somebody that has this problem that's this severe and you see these purple spots, you want to give herbs that mostly move the blood so that it helps the blood, but you have to give something also that tonifies the blood a little bit, not the majority of the formula. And you have to give just a little something for preventing chi stagnation. So when I first started practicing, we would have a pharmacy that would run out of certain herbs, and it wasn't so this is a long time ago, and it wasn't as easy to get everything restocked. And sometimes we would run out of herbs, but for example, this herb, you want to have the majority of the ingredients to be moving the blood, but you also want to have something, maybe one thing in there to move the chi, so a carminative type herb, and you want to have something to tonify the blood, because if you're moving the blood in somebody who's deficient, and they're deficient to the point where they have this blood stagnation, they're probably going to be feeling really exhausted. So when you have that much blood stasis, they're going to need something that tonifies. So when this formula, I've looked in a couple of different sources, and it always says Dangguai, but I think Dangguai Wai, the tail, is also appropriate. Okay. Sometimes these people will complain mostly of heart palpitations, and they're very deficient, and they also have yin deficiency. Now, when you have these kinds of patients, just walking in from the door into your treatment room or getting up from the waiting room, when they get up and they walk 30 steps to move through your office, they're so unwell that they're going to be panting and having shortness of breath by the time they move from one room to the other, or by the time they get from their car and get to your reception desk. It's a severe condition. So Cotinopsis, astragalus, cinnamon. So Dangshan and Huangqi and Guaizhi, these all will help, but you don't want to keep some of these herbs in there. Chai Hu and Zhika need to be removed from the formula if you have somebody where you diagnose them with both. Well, if they have cardiovascular disease with blood stasis, and you decided they're very qi deficient and are yin deficient also. Sometimes it's more blood deficiency than qi deficiency. So these are the changes to this formula when you have a patient like this. These patients always have problems sleeping. Insomnia is always one of the problems these people experience. And it's very important that they start to sleep well. So if you use this formula and they don't improve, ask them about their sleep. They should improve with this, but ask them about how their sleep habit is, how long they sleep, when they sleep. It's hard if somebody with this problem doesn't sleep well. So sometimes the pulse will be very irregular, and they'll not be able to have any normal activity, and they can't sustain any kind of activity. It's even hard for them to have clarity of thought, because when you have blood stasis like this and there's yin deficiency also, their system just really gets out of whack and they can't function normally. So they're probably not at risk for having a heart attack and dying in the next day or two, but they're really very sick and they need help. And so here are the modifications for for this one. And again, if they have insomnia, you can also modify this formula and add maybe swanzalerin or something to help them sleep better. Sometimes you'll find this condition with a lot of symptoms showing that the kidney channel is depleted and deficient. For the people who have this problem, they need both kidney yang and kidney yin tonified. So this last two herbs in the list will do that without creating new imbalances. So this is one of the problems. If you give a patient like this some ginseng, it's going to be too hot because they have yin deficiency, and then their sleep problem will become worse. So if you use something that's not so hot but enters the kidney channel, it will help them more. I think this is a pretty good formula. Yin shu heat doesn't happen instantly. This can happen from hormone imbalances from the Western point of view. But when I've seen patients, they always describe some kind of life issue that's made them worried, stressed. They start working long hours, or they're obsessing about something. So it's related to some kind of unpleasant situation, or they can't stand their coworkers, or they have some family problem where they have arguments all the time, or something where it's very, very difficult, high stress, and they don't feel like they can stop having emotional roller coaster rides. And when that happens, then the yin is consumed, and usually there's some liver flare, some heat, some stagnation. And this formula is very good when you have the blood stations with both the yin deficiency, heat, and you see all these purple spots. So you also get those people who will discuss their anxiety. I mean, they'll volunteer it. And then if they want to talk about that, you can do the herbs, but I think it's important to have a dialogue and say something like, well, is there something you can do so that you don't have this big problem with anxiety, stress, and see if they do anything to help themselves, because they probably need to do self-care for themselves somehow. And what that means varies from person to person. So we've talked about a lot of these points already. One of the problems that happens is people will become more and more yin deficient, and they will become crabby, cranky, irritable, get into bad moods, become angry easily. And this is all a sign that the yin is deficient and that they're starting to have deficiency heat and maybe some liver heat. When I first started seeing purple spots on people, I found it very alarming if they hadn't been injured. And I thought, wow, that's really severe. And I think this is a formula that is a really good basic formula to modify. So that's why I included all the different lists in the prior page. I think it's at a point, if they're suffering like this, that you can help them. it really is something very wrong if you're seeing this kind of problem and the pulses are this severe, but it's reversible. And I don't think it's too hard, if your diagnosis is correct, to reverse the problem if somebody has this problem at this stage. I don't think it's life-threatening, and I think that they can make a full and complete recovery if they're willing to do some lifestyle changes and continue with the treatment. Sometimes people will get treatment and they don't want treatment to continue. I never understand why people will say things like, well, I'm better, but I don't think I'm going to try to get completely well. And it's probably not having to do too much with me, but I mean, people have all kinds of reasons for not pursuing treatment completely. I think that some of the comments that their Western doctor may have poisoned their thinking, like, well, you have congestive heart failure or you have cardiovascular disease and we can treat it, but there's no complete reversal. Your heart's never going to be back to complete health. I don't know why, but I think that if you just do Chinese medicine and you have patients with this problem, you can help them to make a full and complete recovery. But if you don't, or they don't want treatment, then things can just escalate. I think you have to really just do some basic, normal diagnosis at the intake. And you do this at the start of every office visit. Take the pulse, look at the tongue, ask them if anything has changed, or anything is not the same as the last office visit. It's very important to sort out the etiology. If you get that right, I think somebody can get completely well from this problem. So here's a list. You can have deficiency where the yang is starting to collapse. If that's happening and you give them this formula, then they won't get worse. If you don't give them this formula, they're likely to progress into that whole first set of conditions that I talked about at first, where their bodies get cold, their arms and legs get cold, they're exhausted all the time. But at this point, if you do tonification, I think they can recover. They can have heat symptoms, meaning, you know, in Western terms, they have some fever or inflammation. Oh, I have a typo. It's should say Huang Qian. So if they're having some kind of heat where the liver fire or heat is rising up to the head, then Huang Qian is very good to add. So one of the things that happens when people have prolonged heart problems is they stop being able to remember things well. They might have a loss in long-term or short-term memory, or both, or they might have some decline in cognitive ability. Maybe they're trying to say something and they can't think of the word, so the vocabulary seems like it's shrinking. So if you see this problem, you could say it's a mental problem, I guess, but if it's with all the signs and symptoms of blood stasis from a heart problem, then you want to use this formula and add Eugene, it's the radix, it's the curcuma. And I think a good way for people to have this is in the decoction if they're not cooking. But if they're well enough to cook, you can tell them to go heavy and just use this as a spice in their food. I think this is a very important herb, and I'll talk about that more later in this lecture. But this is an herb that has been tested in Western medicine, and scientifically they've shown that there are cognitive changes that improve. That is, if somebody is degrading and they have this herb, that things improve. Remember that this herb is specifically going to help break up blood stasis. So generally you don't want to give it to somebody who has a massive problem with blood deficiency. I think it's okay to give it if someone has maybe a mild blood deficiency, but they need to be tonified as well or before they're taking this herb frequently. Sometimes people have qi stagnation. That's a liver qi stagnation problem that can be resolved with herbs, but that's often because they feel frustrated. That is emotionally. This has started not because their system is just getting out of balance, but because they're having some difficulty that's making them unable to achieve their goals. And then you get this emotional problem, and it causes all this other type of problem. And then, so not only do they have the blood stasis, but then they have qi stagnation that makes everything worse. And then if they have this problem, but they have insomnia all the time, I would say just add the next herb I have listed here is Jiatan. It's very important to give them this herb if they're not sleeping well. Without proper sleep, even if you do all the acupuncture and the other herbs and they don't sleep well, then they're going to continue to have health problems and their condition will probably degrade. People really, really need good sleep to recover from a heart problem. They need to feel like it's okay to sleep, it's okay to rest. They can pay attention to just resting. There's some kind of cultural problem, I think, in our society where people feel like it's not okay to just sleep and rest, but it's one of the key factors for somebody who has this kind of problem to get enough sleep. And they should feel rested after sleep. If not, there's something new that's wrong. So remember, when we're talking about 5 elements, that the emotion is joy. And I think one of the problems that people experience in our society as they get older is they see their social circle, their family circles, their family, their friends, their coworkers, people that they did activities with, those start to shrink and they have less and less opportunities to enjoy life with their circle of people. And humans are definitely pack animals. We evolved in tribes and we need to participate in things with people that we have bonds with. That's normal. And I think that's partly why you see these problems where if a spouse dies, the surviving partner doesn't live very long, is because one of these bonds makes them feel very deprived. I think diet and improving the diet is crucial for people who have heart health problems. Rich foods are very common and easy to get. I think fried foods especially are a culprit in cholesterol, and it's a hard food for people to digest. I think people should have a lot of fresh food, not food that's out of a can, or, I mean, some of that's okay, but a lot of people I know don't cook. If they can't cook, I think they should go get takeout that they know is from a place where they actually have fresh food that's cooked right there as they order the food, not something that's also, out of a box or can that's been sitting around for a long time. Fresh fruit and fresh vegetables have huge amounts of qi, and that's how that gets into your system. Partly is replenishing the qi is from things that are full of qi. And then I'm also a big fan of having bean soup, simple meals like that. I don't think grains should be refined. I think they're lacking in a lot of nutrients if they're refined. And I think most people who are hypertensive will get a big improvement if they just get rid of the salt in their diet. But that means that they can't eat out all the time. And that's a problem for a lot of people because they don't cook well. So if people have stresses and they can't find a way to get out of that high stress situation. They start to get emotional, they start to get upset. And that will result in blood and yin being consumed. And then they can't sleep, and then it all gets worse. So I think we all know this formula is pretty good for these types of problems. And here's one of the modifications. But I think it's important to talk with your patient and have a short talk. I mean, you're not a therapist or a psychologist, but I think you really need to find out if they're going to be able to help themselves so that they're not under such massive stress. Some people feel like they're in jail with jobs that they don't like, or they have some family problem, a difficult situation that isn't going to be resolved anytime soon. And this will definitely create emotional problems. The other big thing is I've run into patients who say, oh, I want to lose weight, so I'm not going to eat any fat foods, and I'm going to avoid fat, and I'm going to count fat grams, and I'm going to have a diet that doesn't have fat in it. And I always say to these people, you can't do that if you want to be healthy. You can't do that if you want to be well, but you have to stop eating unhealthy fat and make sure you have some small amount of healthy fat every day. And I think there's a big point of confusion over this. I don't know why it's so difficult, but we have a problem where people are eating unhealthy fat all the time. If you go to the grocery store and you go to an aisle that has the bottles of oil, I consider most of those to be unhealthy because they are heat extracted oils from plants, and most of them have already had their nutrients damaged. And some of those have such high heat extraction that the chemical shape and composition has been changed from a healthy fat to a polymerized fat or some other fat that's really pretty much like poison in the body. So I don't think it's unhealthy, for example, to have a scrambled egg in the morning, but if they're pouring a bunch of cooking oil into the pan from something where it's conventionally heat extracted, or they're heating an oil that's been cold pressed to a point where it's going to damage the nutrients in the fat, then you have something that is highly undesirable. So for people who don't know how to sort that out, it's better if they boil an egg or they poach an egg if they want a cooked egg. But to have a fried egg at home, it's a lot better to have a healthy cooking oil. So that means looking for an oil that has a high smoke point. So I don't want to get into a whole discussion about what oil is good or bad, but I will say one thing: rice bran oil and avocado oil, if they're cold pressed, these are very healthy oils to have a little bit of fried food in. But most of the other things that I found are very toxic types of fats. I don't think people should have too much fried food anyway, even if they use healthy fat, healthy cooking oils. And we know that trans fats are present in a lot of prepared food and restaurant food, and they are carcinogenic, so they should be avoided. And then people don't consume enough fats that are healthy, and you can get those in organic nuts. You can get that in cold pressed oils. So if you can get some organic sesame butter, meaning tahini, that's an example of a food that has healthy fat in it. But then they can also spoil. So those things have to be kept in the refrigerator. So I had this patient, this was a long time ago, and she said, oh, I had this terrible situation at work and it was very stressful, and my hair started falling out. And then I started eating all the time because it was so stressful. So I gained a lot of weight. Now I want to lose weight. But now that I'm losing weight, I stopped eating fat because I know that's going to be too high calorie for me. So by then, she had been able to remove herself from this very stressful job situation, but her hair was falling out and she didn't feel well. And she felt exhausted even after she woke up in the morning after having uninterrupted sleep. And I said, well, what kind of fat are you eating? You can't avoid it altogether. She said, oh, I try to cut out all the fat. And if I have a salad, I have fat-free dressing. So I said, I don't think that's a good idea. And I recommended, I wrote down a few things, and I'm like, tahini is one of the things. I said, if you can find organic tahini. Anyway, I gave her a list of what I consider to be some healthy fat. And within a couple of weeks, she said she felt way better, but she had been depriving herself of having fat in her diet. I mean, as much as she could, she would 100% avoid fat. And I did give her acupuncture. So maybe you're going to say, well, somebody might say maybe it's just the acupuncture, but I don't think it's healthy. And I think it's really going to damage the heart and the brain if people don't get healthy fat. And this is one of the things that I found over and over again, that people don't understand what that means. It's like, if you explain, well, you need a little more protein, everybody knows what that means. But if I say, well, you need to make sure you don't eat the unhealthy fat and you need to add the healthy fat, people just give me a blank look. They don't understand. And if they don't understand, or they refuse to change, or they've just been doing this a long time, it's going to be a big thing for them to kind of like, wrap their mind around it and understand that fat is a nutrient and they need to have fat. And they're not going to improve their heart health. They're not going to improve a lot of things without it. I think one of the reasons why we get so many yin deficient problems in the clinic is partly because people are living longer, and as people live longer, you're going to consume the yin. And if people don't make the effort to have healthy fat, then you're going to have these yin deficiency problems. So if you look at typical yin deficiency issues, and you look at what kinds of problems have if they're completely not eating healthy fats, a lot of those are the same. Anyway, so this is just one slide, but I think it's extremely important. I don't think it's a little bit important. I think it's extremely important to pay attention to this, especially for patients who don't eat well. So one of the things they found when they're expanding the data analysis is in the Western study, we talk a lot about angina. We recognize that as something that's real heart trouble. And you see this in the movies all the time, as people are having chest and arm pain, and then they keel over from a heart attack. That does happen for men. But for women, the women will feel it more in the back of the body. It's still chest pain, but it's in the back. And nobody knows why. And it doesn't always happen when a woman has heart problems, but it's something that's much more pronounced when women have heart problems than it is in men. This formula, it's a salvia formula, danshan. It helps the middle jiao. It breaks up the blood stasis. So here's the list. It has mostly things to break up blood stasis, and also one of the things here is to remove the chi stasis. So I thought about the 5 element. I thought, well, the heart and the tongue are related. And then I saw this article and I thought, well, I think I should show you this. I'll read it. It's from a dental journal. There is robust evidence from epidemiological studies for a positive association between periodontitis and coronary heart disease. There are 2 cohort studies reporting an association between periodontitis and higher cardiovascular mortality due to coronary heart disease and cerebral vascular disease. So people have heart attack and they have stroke because they have oral infections. That's not a little thing. I mean, this is a 2002 publication. This is 2003. This is always something we sort of thought about and knew, but now there's some consensus agreement that people really need good mouth health, oral health. Otherwise, they're going to have a high risk of stroke or heart attack. So I'm not that surprised, but I think this was a very interesting article to learn about. Now, there's a reason for that, and that's because the pathogens cause the dental infections, and then we now know it can make its way into the central nervous system and into the brain. So this is another quote from an article that I find very interesting. So Treponema denticola is the name of a bacterial spirochete, I think. Anyway, it's a bacteria that attacks the mouth. And the other one, there is a co-infection that causes gum disease. Anyway, when they have these pathogens, they're co-infections in the mouth, so they have multiple bacteria affecting the mouth. If people can't tone this down or get rid of it, by the way, nobody knows how to get rid of it. Nobody in any science or herb treatment, anything that I know of, can completely get rid of it if somebody has this problem. It will create a new problem, and that is that these co-infections break down the normal barrier so that the brain is protected. So this means something, because if you have the pathogens moving from the mouth to the brain, this is, in my opinion, a very high probability what is causing people to have dementia, Alzheimer's, or parts of the brain that get destroyed for reasons we don't understand. And there's a this article talks about Alzheimer's disease. When it says AD, they're talking about Alzheimer's disease. And so when people have these severe oral infections, they might start to lose teeth, but the worst part of it isn't that they have to have the tooth extraction. It's that the infection is very hard to get rid of, and they can't clean up the mouth. So if you have some kind of strep throat, you can take an antibiotic and then they get well from that, right? You could take Chinese herbs or both, or something, and then you retest the person, you look at the throat, they get well. But these problems, these oral infections, when they have 2 and 3 identified pathogens or bacteria that infect the mouth, they don't know how to stop it and get rid of it. They know how to extract a tooth. They know how to tell a person to, use mouthwash or brush your teeth, or use dental floss, or use hydrofloss, like with the water pick machine or something like that. But they never 100% get rid of the combination of these bacteria in the mouth. So it's very hard to get rid of once it starts. And so sometimes a dentist will say, well, instead of cleaning teeth every 6 months, when people get these infections, they tell the patient we have to remove the plaque because you have too much plaque buildup. That's what they're really talking about. They remove the plaque frequently so that the amount of these bacterial loads from these co-infections are going to be removed from the mouth. So in case it's not clear to you, the cleaning from the dentist at the dentist's office, what they're doing is they're scraping off the hard plaque from the base of the teeth, and it's a biofilm. So biofilm is like a little hotel for the bacteria. They're making a home. They're attaching themselves to the bodies in some place, and they're making a home for themselves. And so if someone doesn't get teeth cleaning for a long time and they don't get the oral hygiene taken care of, they're going to wind up with more and more of a plaque problem in the mouth. And then these bacteria, so this co-infection gets worse, and then it has more of an opportunity, a higher chance probability of going into the rest of the body. And this article, so this was published just last year, they're talking about periodontal pathogens entering the brain. That's the name of the article. And I think it's really important to pay attention to this. Now, we're not dentists, but I've always wondered, is there some kind of Chinese medicine solution, maybe a mixture of herbs that you can make a decoction out of, and then that becomes a mouthwash? Would that help cut down the problem? I don't know the answer to that. That's something I've worked hard to try to fix or do, but it's one of the back burner projects I have because a lot of people have this problem. I mean, a lot of people are living longer, and as they live longer, there are higher numbers of people who have persistent infections in the mouth. So when people get dental cleanings, they're getting the plaque removed, which means the biofilm, the amount of biofilm is immediately decreased. And I believe that decreasing the biofilm anywhere in the body is a good thing, because biofilm is a sticky substance somewhere in the body where the pathogen is building a structure for it to be protected against your immune system. It's a part of your body that has gunk in it and it can't come out. It's trying to defend itself and build a home for itself in your body. And we don't want that. So this is more of a quote from the article. This is the important part here. From here, meaning the once they jump the protective area from the central nervous system, in this case the brain, the proposed pathway is likely to circumvent the initial immune recognition of these bacteria, as they will hide within the ganglia, perhaps for many years. From here, they may invade the neighboring neuroanatomical areas of the brain, affecting neurotransmitter release, leading to the early depressive signs in the host. So they're specifically saying that these bacteria finds a path into the brain. Then it can cause Alzheimer's disease, neuroinflammation, and encourage hallmark lesion formation. That makes the blood-brain barrier, so that's the brain's protection, its defense mechanism, is weakened. It's probably actually a little spot that gets bigger, or multiple spots that allow some of the bacteria to get through to where we don't want it. But the really nasty part of this is, once the pathogen is hiding in the ganglia, the body has a very hard time finding it and getting rid of it. So now we're going to talk about congestive heart failure. Congestive heart failure is when the cardiovascular disease weakens the heart, and then it's not a sudden heart stoppage, but it's when the heart has a variety of insufficient action, so the person doesn't feel well. Nobody knows how to totally fix it in Western medicine, and they tell these patients, we'll put you on the list for heart transplant. I believe that many of these people can be helped to recover. And I don't mean just feel a little bit better. I mean, make a total and full recovery from congestive heart failure if Chinese medicine can help them. But they also have to change their diet, improve their lifestyle. If they're a smoker, they have to stop smoking. If they don't exercise, they have to do the right kind of exercise and gradually increase their heart action. So kind of the trick here is to do what we do, use acupuncture and herb medicine and help them with their diet so that they can stay alive long enough while the heart is being repaired by the body. To do that, we have to diagnose properly and give treatment to the root cause. When you have congestive heart failure, typically the heart and kidney channels are affected, and eventually it will be the kidney yang and qi being depleted. If it goes on for too long, it will damage the spleen channel. I had a patient many years ago. She was probably pretty healthy in many ways. She had a job she liked. She was a flight attendant. She was in her 30s. She was single, and she liked her job a lot because she could travel. But she came to me because she was generally feeling kind of run down. And then she complained that she always had minor edema. So she had these legs swelling, and she would have to fly on some long trips, and she didn't have a lot of time off between flights. So she would work a lot and then come home and have many days off in a row. And then she would feel mostly recovered. But she said recently she wasn't feeling rested and she didn't see the swelling go down. So I did the usual thing, talked to her, determined that her exercise, her diet were all very reasonable. So it's not a lifestyle problem in terms of what her routine was. I mean, I'm sure that flying at these elevations didn't help, but I thought that she could recover. So she had some damp, she had some spleen deficiency, she had a little bit of kidney. The pulse was, weak on the third positions. And I thought this is a start of damage to the heart channel. I think it's a little tiny bit of a congestive heart failure problem. So this is what I was thinking, but I didn't say that. I just did the acupuncture. And I think it affected the heart qi. So I thought about her case and I took the pulse, looked at the tongue, and I chose some points. I wanted to give you the list here for this type of problem. This is the points that I usually use. Okay, I'm going to go back one slide. Finish the story. So I use these points. There are 3 points. I use them on both sides. It's a typical retention method. I did it for 40 minutes. And this is almost always how I treat. It's a standard retention method for 40 minutes. I use distal points if I can. I base it on systemic diagnosis only. I don't like using local points. I do bilateral treatment in most treatments. I like to do 40 minutes. I put in the needles and then I do hand stimulation until there is the qi sensation. Then I let the patient rest in a quiet space without normal light. So I try to dim the light or put them in a room where the lights are off. And it doesn't have to be dark, but it has to be without any bright lights. And they usually fall asleep. And then at the 20-minute mark, I will do another round with the hand stimulation. and then they'll rest another 20 minutes. And I remove the needles typically at the 40-minute mark. If someone is deficient, I never needle more than 45 minutes. Oh, let me finish. So anyway, this patient, this is the start of the section on the congestive heart failure. I wanted to say, after one treatment, the next time that she came back, it was the same week. She was thrilled because everything started to improve and she felt like she was back to normal. And I said, I think you need about 3 or 4 treatments total. And I started tapering the treatments so they weren't as frequent. But the first week I gave her 2 treatments and she was absolutely happy. And then after about 4 treatments, I said, I don't think you need to come in all the time. I think you need to come in only if you have a problem. I did not give her herbs. I did not change her diet. I did not change her exercise routine. She still had her job. She would come in once in a while. I don't mean even once a month, but if she felt like this problem was flaring up, I would do the acupuncture and she would totally get better. So that is one of the success stories. So typically, if you have congestive heart failure, if you have the yang that is collapsing, you can have partial heart failure. Acupuncture can help. And the reasons I would choose which points out of that list on the previous slide depends on the root cause reason. Typically, these people are Qi deficient. A lot of them are yang deficient, but if they also have blood deficiency, I like to needle the spleen 10 point. If you do the right diagnosis and the treatment, and you have the Qi sensation when you do the hand stimulation, the results should be apparent very fast. People usually feel better very quickly. This is an herb formula for this kind of problem. Congestive heart failure, and it's usually a blood deficient problem. But it's not for use when there's heat. It's for a cold extremities problem. And the body won't be too affected for temperature, but you can just touch these people and it won't be comfortable for them in their hands and their feet because they're too cold. Oh, let me share another thought about this. So I live in an area where it's hot in the summer and everybody has air conditioning on. And when you get this kind of patient, it can be 100 degrees, 110 degrees outside. They come into a room that's cooled down to maybe 80 or 75. And literally within 5 minutes, their hands and their feet are going to be like ice, like they might have been warmed up from being outdoors. But their hands and their feet are cold, like they've been touching, they've been grabbing a cup with ice in it and they've hung on to that. But it's just because they're so deficient that their blood circulation cannot keep up. Sometimes people have this cold limbs problem from a small heart. The heart has shrunk. It's appropriate to use this even if they're not having heart problems and having congestive heart failure. But sometimes people will be injured and then they have a long illness or a long time where they're mostly not very active. They might have been in a car accident or something like that, or they got sick and they had to rest a lot because they were sick. So the conditioning of their body has degraded. When you see this, they'll tell you about it. I mean, you ask them what has happened, and they'll have small arms, they'll have small legs because the muscles have shriveled up. But what you can't see just when you see this person who's all shrunken is that the heart has shrunk, and you can feel that when you feel the pulse. So this is good for people both who have heart problems because they're deficient, and for people who have had this kind of prolonged rest because they're having enforced bed rest due to doctor's orders or something like that. So as a result, the heart, because it's also a muscle, has shrunk. So this formula is good for people that have this congestive heart failure and for people who have been injured. It's not really heart failure, but the fatigue will be the same for these people who have had prolonged bed rest. So this is very debilitating. I mean, these people will be able to get out of bed and walk around because their injuries are healed. But if you ask them to go for a walk for a mile, they're going to be exhausted and they're going to be slow and they don't feel well. That's not because of some kind of unusual yang collapse, qi and yang deficiency. It's because their heart has shrunk so much. And that's when you use this formula, when you have someone who's recovering from prolonged bed rest, or you have somebody who has poor circulation from the kind of systemic problem from congestive heart failure affecting their whole body. So this is the recap of what I talked about before when people come in from a hot spot to a air conditioned area. This is a symptom that's easy to detect. I mean, you touch their feet, you touch their hands. It just takes literally, 20 seconds. Feel their extremities. Feel the hands, the feet, the arm, the leg. And a lot of times people just think that's normal, but most time it's because their system is out of balance and they're deficient, or maybe they are healthy. They think they're healthy, but they have this problem. It's a key symptom. It's to be paid attention to. I know people who have had desk jobs. Maybe they're working in a cubicle or sitting in front of a computer, or they do other things where they're doing accounting or they're an actuary or whatever, but their job involves sitting down a lot. You have to tell these people to move around. So, take a break. You don't sit in front of the computer for 4 hours. You don't sit in front of the TV for 4 hours. You get up and you move around every 30, 40 minutes. The body isn't built to sit still like that. That actually will be damaging to the heart if they are still too much. So yang collapse, yang depletion was what we talked about at first. This is not as severe as that. It's cold from yang deficiency, but it causes the blood to get more and more stagnant. This one has the aconite in it. When you touch the pulse of this kind of patient, sometimes it takes a little while to find it, and you can tell the heart's beating. If you listen to the heart is beating, but the pulse is very hard to feel. This kind of patient has a very serious problem. And if you see this kind of patient, they're probably unable to eat and drink normally. If they want the Chinese herb medicine, they're going to be able to have the decoction better if they can tolerate the taste. And so if they're, in a culture where this is what they do, you can give them the prescription for a decoction. But this is probably a fatal condition. This is another one where there's almost a total collapse. Person can't do an activity. They're exhausted. Their system is cold. You have yang collapse and qi deficiency. Zhen Wu Tang. This is when you have cardiac problems that causes edema. So this is like a classic congestive heart failure patient. If it's from cold, you can use this formula. You'll see some edema. The tongue is going to have the scallop teeth mark on the edges. It's a spleen and kidney injury from the weakness. So it doesn't usually happen that you have the kidney and spleen channels getting hurt first and then damaging the heart. It's usually that the system is depleted, then the heart becomes weak, and then the kidney and heart yang have nosedive, and you have some depletion that enters the spleen channel and then causes the body to have this edema because the circulation in the skin is poor, and the body is trying to keep circulation going in the viscera. These people are very sick, but if you give them herbs and acupuncture, they should recover. When you see the purple color, purple spots or dark tongue body, then you can bump up the formula with the Honghua, the Carthamus. Some people are constantly short of breath. Then you can also add the Dangshan, the Codonopsis. When these people have edema, the herbs will help them. Oh, so that's the Juxta Yi Ren. So that's the koi seed, Chachenza plantaginus. This is actually a simple treatment. I would use only 3 points bilaterally, and you can see tremendous improvements just with that. If you're in a position where you want to do moxa, I would do moxa on the kidney 3-point also. Sometimes you'll have yin deficiency causing some dryness, and you want to protect the moisture in the body. This needs to be diagnosed properly. If they have a yin deficiency, you want to make sure that you're not exacerbating something. So the Codonopsis, my Mendong, these will help this condition. The my Mendong is very good to protect the yin deficient patient. It helps people to sleep too if they have some kind of insomnia. So congestive heart failure can be helped with this formula that has the Fu Ling in it. It helps the spleen qi and helps the edema, helps the shortness of breath. So this is a typical weakness syndrome, and you can see pale tongue, and you can feel the pulse. It'll be weak, but it won't be imperceptible. They can live a long time like this, but it's hard to cure in Western medicine, and I think with herbs and acupuncture, they can improve pretty quickly. Sometimes you'll see people with swollen legs, and it's from a heart problem. You need to clear the heat if they have heat symptoms. So this page is for reference when this slide has the details of this kind of formula. And one modification possible. So a lot of these people can't even do normal activity, and Baiju is contraindicated when you have heat. So I would take that one out and put in Shanyao, the Dioscorea. And then when the heat has been cleared, then you can change the formula back. But Baiju and Huangqi are hot enough where if anybody has any kind of heat symptom at all and they have congestive heart failure, I would take those out and substitute other things in to help with the qi deficiency instead of using those. Sometimes people stop urinating normally. I would use acupuncture if they have congestive heart failure with not very much urination. These are the points I would use: spleen 6, spleen 9, kidney 3, stomach 36. And if they're coming to you 2 days in a row, then you can take a look and either the treatment help them to really start in the right direction or it won't. If it doesn't, then you add herbs on the second day. This is really a spleen qi crashing type of problem because it's so severe. The kidney yang and the spleen qi have been damaged. And then you get these edema and swelling problems in the legs. So people with congestive heart failure do need exercise, but they can't take much when they're first starting to work on it. So again, the goal is to keep these patients alive and help them build the size of their heart and the pumping action of the heart. The heart channel has to gradually improve as the whole rest of the system improve. When that happens, you'll see all the other channels getting normal and the other problems like the spleen qi deficiency causing the edema, that will improve probably first before anything else improves. And then it retreats because the spleen tonification means that you're not going to see the edema and the urination will be normal. And then you'll see the kidney qi symptoms returning so that they don't have so many problems and weakness when you touch the pulse or, you know, their system returns more to normal. And then when the heart starts to improve, you'll see gradual improvements. They'll stop being short of breath. They can walk longer for further, but they should never be told that they need a lot of vigorous exercise. That's not the way it is. You have to treat them like they're 90 years old, recovering from something very severe, and they have to be maybe doing exercise for 2 minutes the first day and 2 minutes the second day and 2 minutes for a couple of weeks and then increase to 3 minutes. I mean, it has to be very slow and gradual, whatever is that they're comfortable with. And they're going to be short of breath. They're going to get these sensations of, you know, real discomfort because they're not used to it. They're going to feel warm and sweaty and they're not used to it. And you have to tell them that's what's going to happen, because if they really have had this problem for so long that they've had 3 channels being affected, they're not going to know what it feels like to feel good when your body gets warmed up and you get exercise and the heart starts to grow. And when it starts to grow, they can go a little bit longer, go a little bit faster on their walk or whatever it is they're doing for exercise. Probably at first, if they're very feeble, they can't even do a walk. They have to do maybe some stretching, sitting down in a chair for 5 minutes and then standing up for just a minute or two and then gradually work up to a walk. I mean, people can be so weak that they have to do very slow increases. Sometimes they have a bad diet, and when you go out to eat or you buy, you know, a frozen dinner or food that's prepared or a snack, it has just loads of salt in it. It burdens the kidney channel and then later the spleen. They need to stop eating too much. They need to stop eating too much salt. So here's a formula for kidney and spleen where it affects the heart qi and the heart yang. Wu Pi Yin is a formula. I've got the ingredients listed here, and it uses just the skin or the outer part of these plants. So do the diagnosis, look at the tongue, examine the tongue and the pulse, make sure this is the right formula. Yin Chen Wu Ling San. So this is a formula that's usually for jaundice, but I put it in here because sometimes people have congestive heart failure and they have jaundice. It's very serious if they do that because you've got multiple channels affected. They have damp and heat. You'll see the tongue with a coat that's yellow, and it's usually kind of thick and slimy looking. This formula is for that kind of patient. If they have jaundice in a lot of places, like you can see really a lot of jaundice all over their skin and their face, you add huang bai. Or if it's more damp, then you add hua xiang. If they're not urinating, you add the mu tong. this formula should not be given long term. It should help clear up the jaundice, and then you can use a different formula. So for sinus problems, nose is the orifice of the lung, and sinus infection in seniors can be a high risk. So you have acupuncture and you have herb medicine, and for these patients, if it's really entrenched, they should start doing some qigong. I have to look at some notes here to give you there's a page, I'm not sure that I included it in here. Just a second, I'm sorry. I think I left something out in one of my thoughts here. Oh, so we had already covered what my basic treatment is. I left that one thought here. When I do acupuncture, I wanted to mention that most of the time I use the thinner gauge needle and it works fine. I don't think you should use the heavier gauge needles unless you have somebody who's tall with big bones, big muscles. But for the normal person, I use the 34s most of the time. I think 30s are too big for most people. I've had people ask me about acupuncture and say they want a, I mean, they're surprised a lot of time that they just get 4, 6, 8 needles, and they say, well, don't I need more points? And don't I need needles where it hurts? So I gave a quick recap of the normal 40-minute treatment that I have, but the size of needle is important. And also, if a person has a problem on one side of the body, I needle the opposite side. So for example, if somebody has a left shoulder that hurts, I will only needle points on the right side. If somebody has a headache and it's on one side, then I'll needle on the opposite arm typically. And not everything is like that. There are some points that I use that are on the midline, but I think it works best to use distal points. And I think that if the problem is pain or some kind of difficulty on one side of the body only, it's really going to be better to use points on the opposite side. So since my treatments are usually bilateral, meaning I pick typically 6 or 8 points needle by choosing 3 or 4 points bilaterally. If someone has a problem that's just on one side of the body, I will still pick no more than 3 or 4 points typically. And I've had really great results from this. So that's one of the thoughts that people who are new in acupuncture, I don't know if they teach us in school, but that's the way my mentor showed me how to do treatment. And I have found it extremely effective. It's not a little bit effective. It's hugely effective. And people can feel things immediately if the points are chosen well. And it's the right diagnosis, and the treatment is on the points, on the channels that will help that spot. So one of the treatments that isn't in these slides here, but I wanted to talk about it a little bit for heart problems, is a lot of women, when they start to have heart problems, it's not just back pain that they talk about a lot in Western medicine, as opposed to chest pain, where the men have the arm pain and chest pain. They also will have a shoulder pain, and the shoulder pain is typically on the left side. But it is something that is connected to this heart problem, or they'll have a knee problem. And if it's a knee problem and it's just on one side, then I would choose points on the right side of the body and do acupuncture on the right side for left side pain. So for the women, if they're having heart problems and they have pain on the left, I don't think I would needle bilaterally. I would choose whatever points I think are the best for their underlying condition, but needle only the right side if they're having this left side shoulder and back pain due to congestive heart failure or a heart problem, or, you know, you're pretty sure that the heart chi is what is being affected or the heart yang is being affected. That's from experience. That's not really something that I've read in a book, but I think it's important to pay attention to. So I believe that this is a very useful idea. And the way my mentor explained it to me is that people have energy that moves diagonally through the body. So that means that if you draw a figure eight, then if you find a problem, for example, with the upper left part of the body, then they have pain in the shoulder and the back, or the shoulder and the chest, then look for points that are distal on the correct channel per your diagnosis. So in this case, it would be needling on the right leg. I think it's time for a break. Is it time for a break? I'm not sure.
Sure.
Or do I go another hour before we break? Is it now?
Yes, we should go on break right now.
Okay, so I guess I stop my video. Is that what I do?
Yes. And we'll take a 15-minute break.
Okay.
And we'll return at 10:17 a.m. Pacific time.
Okay.
Recording stopped.